don't want to take much of your time.
This
So
meeting is being recorded.
I assume maybe we are on the same page. It's also my first time meeting you guys. So maybe before I start, do you have some specific questions which you want me to dwell on, or do you have specific needs which you want me just to quickly run through over? Maybe I can just save you time. I just take it as a no. So I'll just proceed with my presentation. So this is an outline of how we're going to, I would expect you to answer our questions or our assignments. I just took this one from your course outline. So I would want us to achieve 75% plus on our markings. I wouldn't want us to get a poor or 0 to 49. So basically, this is what your university, this is Mancosa, expect you to score on each and every assignment. So guys, can you just pardon me? It's raining here, so I don't know if you are hearing me, or I have some echoes at the background. Which is which? Can you hear me properly?
Yeah, see, yeah, very clear.
Yeah, it's clear also,
Okay.
my side.
Okay. So the first question, so this is like what I was saying. I expect you guys to refer to the guideline. I'm sure this is something which you have been told by your previous tutors. There's no need to be hard on yourself, just to follow what the university requires you to do. So the first question is saying, please, we must not write more than 2 pages. So we're just gonna follow the simple instruction, because at the end of the day, it's the lecturer who is going to what to mark your assignment. So the first question, if you read the case study, um, unfortunately, if I start opening the case study, it will take some few minutes because my PC is very slow. But have you read or have you gone through the case study?
Yes, I have.
Okay. What about the other guys?
And me too.
No,
No.
Okay. Oh, okay, fine. I understand you guys have been at work or you have other commitments. But anyway, it's my duty to do the reading for you. That's why I prepared this presentation. So in the event that you manage to go and go through the case study, which I would advise you to do that, the first question is asking us, so the question reads, the case study argues two fundamental business, blah, 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 right? So the question is asking us to come up with or to summarize the risk management process that healthcare providers should follow to operate. So yes, it is giving us the difference between the full risk model and the shared savings model. So it's just defining what a shared risk model is and also a full risk model is. So the first thing which I expect you guys when you are attacking this question is very simple. So introduction. So the introduction, some other people, they actually say the best way to write an introduction is after you are done with the whole question. I don't know if you guys want to make to try it, but for me it has been working better on my side, because that issue I could have managed to comprehend everything which I want to go through, or to understand what exactly I'm supposed to say. So the introduction is the first paragraph which you need to introduce your key arguments or your key issues which are needed to answer your question. So a good example, wait, where is my, let me just give you, I will share with this slides with you guys. So I'm just giving you a good introduction. So sometimes you can make an introduction by defining it, like what I've done here. Risk management in healthcare comprises of clinical and administrative systems, processes, and reports employed to detect, monitor, assess, mitigate, and prevent risks. By employing risk management, healthcare organizations proactively and systematically safeguard patient safeties as well as organizations' assets, market shares, accreditation, reimbursement levels, and brand levels and community standing. So, as you can see from my introduction, I've already introduced my key questions. I've introduced the question of risk management as a part of my what? My introduction. And also I've already defined it. So it's up to you guys if you want to define what exactly your key question is in the introduction part, or you can even define it in the first part of your board of your assignment. Because normally, if you are writing these post-grad assignments, would expect you to use what you call the funnel approach. So this is where you are coming from a broader spectrum. Then you are narrowing your spectrum till you get to the point which you really want to address. So sometimes you can do that depending on the nature of the assignment, but in this case, I wouldn't expect you to go as further as the funnel approach, because it just needs you to write 2 pages. So this is what I expect you to write on your introduction part. Are we together on that?
Yes.
Okay, interesting. So then here we have to go to our board, right? So the question is just straightforward. We just need to link our risk management process to the what? To the shared model and also the full risk model. But also, this is specific, this is healthcare. We don't need to broaden our examples. Let's just stick to what we have been told, because this is a case study. We are supposed to answer as per our case study. So if you had a chance to go through your marking scheme, it's actually telling us that it's expecting us to get an overview of the SIO 3100 diagram of the risk management process. So this is what the risk management process is. It's not limited to this one. There are so many risk management process diagrams which you can get over the internet, or you can even quickly refer it to your start module. So, but for me, this is what I got. So the first one is the communication and consultation stage. Of course, if you are using different reading materials, they might differ, but basically this is the general outlay of the risk management process. Guys, don't forget to put a diagram. You know, sometimes your lecturers, they don't want to go through everything. They just want to see a snapshot of what is happening in your assignment. So sometimes you save a lot of stuff by just putting a diagram. But of course, when you are putting a diagram, you also need to explain it. So the first step when we identify is the risk identification. So anyone who would want to help us with the risk identification? Hey guys. Anyone would want to try? I understand you guys have not been going through this, but maybe if there is anyone who would want maybe just to say what he thinks or what she thinks is about risk identification. Okay, so from this case study, so we're saying, so since risk management involves managing uncertainty and new risk is constantly emerging, it is challenging to recognize all the threats a health provider faces. However, through the use of data, institutional and industrial knowledge, and by engaging everyone, whether are the patients, administrators, a healthcare risk manager can uncover threats and potential compensatory events that otherwise would have had to happen. So a good example of the risk management stage is when you consider a good, maybe in an emergency room, there's what, if you have observed in the healthcare, they normally put those tirage system whereby they put a wristband which relies on the color coded to categorize different patients based on various complaints, that is based on their different illnesses. So suppose you are given a red wristband, which signifies to the health provider that you need immediate attention. Then the other one is given a white wristband, which signifies that there is no real emergence. So this is where there is the risk identification to say, if this guy is needing urgent attention, then we need to save him as urgent as possible. Because if you serve the person who doesn't need the agent as what do you call it, care, maybe you might end up losing the first guy because of the seriousity of the illness. So this is where you need to identify what you need to do and how you need to manage that risk. So the second step, this is where you quantify and prioritize the risk. It's almost similar to the first stage, but in this case, you now need to identify who really need the urgent attention. So once identified the risk, it is vital to to rank and prioritize the risk based on the likelihood and impact of occurrence, and then allocate resources and assign tasks based on those measures. Are we good so far? Hello, are we good so far?
Yes.
Okay. Yes, we still good, bro.
Okay. And anyway, I'm going to send you to share with you this one, the slides, so that at least when you are working on your assignments, it will be just easy for you to refer to everything. So the third stage, so it's saying select the appropriate combination of techniques for threatening the loss exposure. So this is an area which is so interesting, which involves you investigating and reporting different events. So you need also to perform compliance reporting, because in healthcare, you need to fill in those compliance reports whereby you need to book a patient, also whereby you need to do the regular checks to say if a doctor comes.
Sorry to interject, sorry. Just a quick one on the first step on identify risks. You given an example about the color of the wristband in an emergency room. So wouldn't the wristbands be like a form of a control to prevent loss of patients because they were not attended to in time? Wouldn't the type of the band that the person has be like a control for the hospital or the emergency room?
Okay, it can be, but the first thing is done after you have identified the risk. So the thing is, for you to say this is the source or this is where the risk is coming from, we need to first identify, isn't it?
Okay, yeah.
A lot of patients, they are coming into a hospital, right? And then maybe it's not even a doctor who is doing that. It's maybe just a mere nurse or just an administrator or a receptionist, based on something which you can easily see. Maybe the person is on stretchers, the person is actually walking well. So you can actually say, okay, fine. Can this person who is on the stretchers, I give you the red wristband to show that this person actually needs an urgent attention. And then the other one, the guy who is just coming, maybe he's doing the random checkups, maybe once his chronic pills. Of course, we can't say it's not urgent, but it's not as urgent as the previous guy. So this is the first area where you need to identify your risk. This is an emergent room. This is your first area. Because without doing that, you can't even know. That's where you can see people queuing in a long queue. Then the next thing they say, the pregnant women, can you come in front? Then followed by the elderly, then the other one, the rest will follow. This is the risk identification, because you know that if you fail to identify the source of risk there, then maybe a heavily pregnant woman can give birth while she's still in the queue.
Okay, thank you for clarifying.
Yeah. Okay, so this one, guys, the question is too broad. These ones, it just depends with the way you want to attack this question. So this is not exactly what I'm saying, go and do this. I'm just trying to help for you to understand what I'm expecting you to do when you're answering this question. So it just depends. You can even, but basically these are the steps for risk management process. But the reason why I gave you an example is for us to make relevant to the question, because remember, it's a risk management process in the healthcare. Do we understand each other? So it's easier for us to attack it with an example, because without an example, you will be just writing the generic risk management process.
Yeah.
Of which you need an example, you need a diagram, you need also to explain what you have raised in the example which you have you've given. Yes. So in this case, like I'm saying, so we have capturing learn of from near misses and good catches. Like an example which I gave you for a pregnant woman. These are also from a risk management point of view. Remember, we are saying the full risk model, the healthcare provider is the one who is going to bear the risks, the cost, to make sure that you guys have access to the medical care which you need, right? So if there is a scenario whereby a heavily pregnant woman needs an extra to be admitted, maybe because of the mismanagement or negligence from our side, it means it's an extra cost which we are going to incur. So events which comes and go, which are not managed, this they give you a head up to say, next time, guys, we need to do this. This is where we need to go and capture the near misses, the good catches, to say, if only it wasn't about our risk management process, our risk identification, we could have lost this guy and we could have incurred more and more cost. Okay, so make sure you use a techniques of risk avoidance, loss prevention, loss reduction. This is the area where you need to select an appropriate combination of techniques for you to reduce the loss exposures. Okay. And then now we are on step 4. After recording everything in step 3, we are now treating the risk. This is the actual risk management tool. So every risk depending needs to be eliminated or contained as much as possible. This is done by engaging the experts of the field, the risk modelers, the actuarial scientists. These are the ones who can tell. The risk managers are the ones who can tell you what to do. So in manual environment, this entails conducting each and every stakeholder, then setting up meetings so that everyone can talk and discuss the issue, right? So we also need, this is an area where we also need to invest in a robust risk management information system. This is where we need a good, proper information system so that you can you can compare the risk, you can manage the risk in so many different ways. This is basically where the management tools come into effect. Okay, and then we have the last stage of monitoring and reviewing the risk. So maybe you have been doing this for the past 2 months, or for the 2 months, I can't say this. For the past 1 year, this is a period which is long enough for you to give a comprehensive assessment, right? So this is where you have to go and review what you have been doing to say, did this work or it didn't? Did you manage to reduce the loss exposures with what magnitude from your previous maybe financial year to say, no, this time we have managed to reduce the number of deaths from emergency rooms by 10%. It clearly shows that your risk management system is working well. This is whereby you can manage to say, you see what, the risk model which we have incorporated, it actually increased the number of people who have been admitted. So the more this means if you are, the more number of people are admitted, basically means is the more cost which you guys are incurring. There are no savings, because the more number of people whom you are discharging, these are the savings. So this is where you have to go and see and review your risk management process to say, is it helping? Is it reducing? Is it giving us extra cost? Is it actually saving? Because this is about risk mitigation. Say, what exactly are we doing? Did we even eliminate those risks? So this is the stage which we need to also to focus. So from our case study, this is something which I just expect you just to follow, making reference to the case study in terms of the healthcare. It's more of a straight question, but you also need to make reference and to make your argument and to what do you call it? To evaluate your question, so that at least you are giving your hands up to your lecturer to say, this is what I'm thinking as far as the risk management process is concerned. And then, of course, I expect you to make a conclusion based on what you have raised in your board. Maybe there's something which I've also skipped. I think this thing. So do we understand the difference between this full risk value-based care? Hello, guys.
No, please explain.
Okay, so basically we're saying we have the insurance companies. Let's say just Discovered. So these are the commercial insurance companies. So they go into a contract with a healthcare provider. So let's say just say Mill Park. And then, so whenever we are paying the premiums, these guys, when they go into a contract with say Mill Park, then they will agree that they will transfer all the financial risk for the patients they are going to treat, so that the provider is the one who is actually going to pay for any emergency cares, for any specialties which they require. So in the event that you didn't go and get treated, these guys, remember you are paying every month, they actually take it as savings from their side. So that's the benefit which they get. But in the event that you guys keep on going and get the specialists, you keep on going and get their services, they are also the ones who are going to pay. So the risk is on the health providers and not on the commercial insurance. So this is what you'll be trying to say in your argument, in your assignment. Okay, so I think I'm done with question 1. Let me go to question 2, because I just want us to go through question 1 and question 2, and then let's see. So the second question is the one which is a little bit challenging, guys. This one, it's not a straight question, but it needs you to think outside not to think outside the box per se, but just need you to link what is in the notes and what is actually in the case study. So I've actually helped you to come up with different scenarios, so that you guys, you won't go as further to research. I've just done everything for you. So the first thing is the question. It's one of the key aspects of risk management process that healthcare providers should be using as an essential tool is risk modeling, right? It can be argued that the sustainability of HCP's a comprehensive understanding of fundamentals of risk management is critical. Using appropriate diagrams, propose a risk model showing all the relevant inputs, outputs of this risk model. Okay, I'm sure if we have people who are working here, especially in the financial fields, we are quite aware of the models. It just depends with the model. Can you be in finance? You can come up with a different model. If you are working in a bank, maybe it's a model which you use in your credit department for you to advance loans. Maybe you're actually doing the credit management side. Maybe you are in marketing. It's actually, maybe you have your own model, which you also need to identify your target clients. If you also it's so different departments. So basically, a model is just a technical or a technical system which you use to predict a future outcome, or for you to come up with a certain decision which you would want. It's more on the technical side. So in this case, it's about the healthcare providers. We just need to come up with a risk model which can manage the risk of our healthcare providers, or at least reduce the risk from their perspectives. So it just depends. So this is what I have come up with. So this is just the definition of risk modeling. Refers to the total quantification of all risk, implicit honestly and explicitly to understand the true nature and the impact of risk which has been said. So risk modeling can be looked at more specific in terms of finance and operational department. Okay, so how do organizations use risk models? So you might want to understand the risk to achieve a broad strategic objectives or to answer a very specific question. So this is what I've been saying earlier. We also use as hypothetical testing to say, what if this scenario happens? What is our total loss which we are going to incur? What if we manage to mitigate this scenario? Are we going to reduce the risk with this amount? So this is exactly what we use our risk model. So from the question, what type of risk is this? For me, it's an operational risk because operational risk is the risk of loss resulting from ineffective or failed internal process, people, systems, or internal events that can disrupt the flow of business operations. So in most cases, let's just take it practical. What can happen for healthcare provider to incur losses? Definitely, it's a failed internal process. Because if there is no internal process, then it means there are the core of natures which we can't deal with. If God says yes, He says yes. So a good example is what I've been giving you previously in question 1. I'm just expanding it to say, so we're consider you are in an emergency room at Netcare Moorpark Hospitals. System that primarily uses the color coding to identify or to certify its patients, right? So there's a 65-year-old guy who is just coming from attending maybe a real estate conference, which is just being held downtown. So, and then at one point in the evening, a 65-year-old just decide to go. This person maybe has a history of hypertension, by diabetes, and then he drives himself to that local hospitals and awaits care in the triage. Then at 7 p.m. on Friday, then there's a shift change, and then there is another person who comes, right? And then suddenly, because the patient stops breathing, the nurse who has just began his shift rushes to the patient's side and notices a purple wristband, mistaking it to do not resuscitate band. And then she resuscitates. Already, there is a risk, which is a possible risk event, which is there. You were just supposed not to resuscitate the patient, but because of the color coding which have been there, this person was mistakenly saying this person should not be resuscitated, but this person is actually not breathing, which means he has to be resuscitated. So these are the errors which you are saying. If we want to avoid, what do we do? There are so many factors here. And these factors, we need to mitigate them, and we need to come up with a model. So this is where the model comes, right? What is the model? Yeah. So there are techniques which you can use when you want to use, or the tools which you can use when you want to use your model. You can even come up with a regression model based on the historical data. You can come up with a decision tree techniques to come up with a model. You can even do interviews to come up with a model. And of course, this is the most technical one, the Monte Carlo simulation. So it just depends with what you guys want to use. So for me, I think I'll just use the Monte Carlo. So, sorry. So this is my model, which I'm going just to define to say, okay, fine. What is the total loss which we are going to incur as a result of us having an inefficient service in the emergent room? This is my model to say the total cost is made up of this is just a simple model which you have defined. I'm sure maybe it's not new to most of you guys. So this is just a simple linear regression model, which is a function of the independent and dependent variables. So this is just the dependent variable to say total losses is as a result of A plus XB plus C, where B is our medical error in the emergent room. So how are we going to mitigate this thing from a risk point of view and from also the HCP point of view? So the moment they define their model is the moment which they can come up with a decision to say, okay, fine, if this scenario happens, then this is the maximum maybe total cost which we are going to incur. But if only we can do different, if we can do this, we can avoid such a total loss in a certain maybe magnified a value, to say maybe in 20,000 or 50,000 rands per month if we do this. So for me, I just said, okay, fine, let me use the Monte Carlo. But before that, I also compiled you different examples of scenarios which need to be modeled. So you can even use patient flow. You can use vaccine allocation. Right now, there's also COVID. There's you can stimulate population with a specific chronic disease. You can even do the schedule ER department for physicians. Even you can come up with a model for patient flow. Just depends. Like I said, if you want all these things, you can take them, but there are so many situations which needs you to come up with a model. So after defining my model, what do I do now? So the first thing which I need to do is to use the Monte Carlo to perform my model, to run my model. You can even use, like I said, you can use a simple regression model. Simple regression model, or you can just use whatever the case which you think of, guys. There are so many models. In my field, we also have different models which we use to perform for different clients. So like I'm saying, it just depends whatever is comfortable for you. So in this case, Monte Carlo is just a computerized mathematical technique that allows people to account for risk in quantitative analysis and decision making. So the technique which is used by professionals in different fields such as finance, project management, etc. So Monte Carlo simulation furnishes the decision maker with a range of possible outcomes and the possibility they will incur for a choice of action. So in most cases, Monte Carlo is used for scenario analysis because there are so many different variables which are at stake. The edge. So in this case, we need the inputs. So this is the diagram which I just used, because we also need to use a diagram with this person. So this is just a standard risk assessment model. So these are what makes up our risk management assessment model. So the first thing which we would want to define here is the probability of a risk event. In most cases, probabilities of risk event are given maybe based on what have been happening in the previous events. So in most cases, they are there. They are there based on what happened before. So these simulation models are often based on data sources, historical. Okay, so nowadays, the growth in health information system, yeah, that's the good thing, is there in the system, uses what? Data extracted from healthcare information system. That's where you can get the probability of any risk. E.g., data from stats, you can get it from annual figures, maybe from the healthcare, from the health sector. They also have their statistics, which shows different possibilities, especially maybe they have different probability to say if a patient is more than 80, there's 60% chances that you'll be by diabetic. That's so different probabilities there. So from there, we have a risk event. So like I'm saying, just the use of resuscitating machines in emergency room. So this is just a risk event. You just align to what you guys actually want. You can even think of any other thing as long as it's a model which is going to help the healthcare providers to mitigate or to manage their risk. So this is here, we're just looking at the inputs, the risk drivers. What is it? Maybe it's a drunk doctor who just came and they don't know what he's doing. Maybe it's a color blind doctor or a nurse, whatever is just the possibilities of these are risk event drivers. And then we have also the impact and probability of impact. So an impact is an estimate of a harm that could be caused by an event. So in this case, what is the probability of death? That's the impact. What is the probability of this person who end up being discharged? It's also an impact. What is the probability that this person will end up being admitted? So if that person is admitted, it's a cost again. So you also need to simulate to say you have different scenarios. Say, okay, fine. If you were to use a resuscitating machine to a 50-year-old person, what is the probability that this person is going to be discharged? Then you have one. What is the total cost which you will have saved or which you are going to incur? So if you run your model, it has to give you such an outcome which can tell you that, okay, fine, if you resuscitate a 65-year-old person, maybe you will end up discharging this person and will then save 20,000 rather than for him to be admitted. This is just one scenario analysis which you have done for you to what? Which you have done for you to mitigate your risk or to manage your risk. Okay, the other issue you say, now we are going to simulate to say, okay, well, simulation is just running your model in different possible outcomes to say, okay, fine. So we have a kid, right, who has just stopped breathing and doesn't need resuscitation. What is the probability this person may end up dying? And if that person dies, maybe there are so many claims which are going to come up with the impact. And how much would you have reduced if this person didn't die? Things like that. So this is how we are going to come up with that model, which we are just going to use with Monte Carlo. That's the good thing about Monte Carlo, because it simulates different possible scenarios. It's actually scenario analysis. So the model output, which just needs here, output refers to a series of services offered or hours during which service is available. So like I'm saying, so output can be quantified in terms of numbers, quality, like total cost. Like I was saying, what is the amount of cost which we have incurred or which we have reduced because of the use of a certain model. So this is how the risk managers are able to mitigate or to manage risk from their from an HCP point of view by coming up with different types of models. So in this case, our model output is just the total loss. So what is the total loss if the patient ends up being admitted or discharged? Since the HCP has been paid by the provider, then it's going to be expensive for the hospital to be, if that person ends up being admitted, because it means there's an extra care, there's extra food, extra specialists which are needed. So you just need to perform for different scenarios. So this is what I've been, this is what my model is actually saying on this question. But there are so different models. This is just a guideline for you to say, if you want, guys, you can even try to do just a simple model on Excel, and then you can just paste it on your assignment. I don't know if you want, but you also need just to, I think the figures and the figures, they are not really, we can't put the figures because so like this is what we want. We can't run a, we can't do a Monte Carlo simulation with this assignment. But I think what the question, the lecturer wants to see on your assignment are things like these ones. What are the inputs? What are the outputs? This is what is very important to understand, for you to see if you do understand what the model is all about. So if this is what I expect you to write on your assignment. So if you guys have any questions or if you want to add anything, I think this is the time when you can do that. Hello, guys.
Still, yeah, no questions for now. Just a quick one. Are we allowed to just ask questions as in when we are busy doing this in the chat maybe? And will we get a response?
It's fine. Yeah. Because like I'm saying, it just depends. Yes, you can. Because your assignment, obviously, you guys are not going to write the same thing. So this one, I was just trying to give it a heads up to say, this is what you must do. I think you must follow, or you can try to follow for you to answer this kind of a question, because it's more technical. But of course, you also need to put the the flesh on what I've been saying to explain it. This was just a quick run through of what is required on your assignment.
Okay, thank you.
Okay. I think the best, it's actually best if you are asking questions based on your specific assignment to say, what is it that I need to do this? Because this is just a general example. So I can't expect you to use the example which I just used. Here, the reason why I used this one is because it's what I just thought maybe I could use as an example.
So James, are you saying that should I get stuck while I'm busy doing the assignments, even if it means tomorrow or Monday? Yes. I can still ask the question.
Yeah, okay, let's do this, guys, so that at least it will be easier on my side. We're supposed to meet again. I don't know when you want us to meet for question 3 and 4. So I think the best, right, is but you guys are actually, I mean 1, 2, 3, 4, 5, 6, 9, 7. So I don't know the 7th. If we will be able to I will be able to answer each and every question from your side, guys, based on your different assignments. I don't know if I will be able to do that on a single lecture or any single whatever, yeah, on a single lecture. So I don't know if I will be able to do that. But I was thinking that if you guys have questions on your assignments and question, especially question 2, right? Is it so?
Yes,
Hello?
especially question 2. Yes, that's
Yeah, because question 1, yeah, question 1 is not that difficult. It's actually something which is in your notes. The only thing which you just need to do with question 1 is just to link it to your case study. But for question 2 is the one which is just gonna be what is it? Challenging. But what I can do is you can just try to go through what I've been saying, but also I'm going to share with you a good model which you can see. It's not I don't know if you guys are aware of what a model is. How many of you are actually working in maybe in financial sectors or where you are required to use a model? Do we have anyone? Yeah.
James, Tina, we are even worse because working in the mines. So this one is gonna be difficult.
Yeah. I see. Okay, fine. But I think I will just come up with something, a simple thing, which you can, which have inputs and then the model and then the outcome, just to show you, how you can use that. Let me just see here. I think I'll just come up with that thing. But at the same time, you just make an arrangement with Jasper, so that at least if you guys need assistance from me, but of course I'm not going to be able to assist everything, right? I'm just gonna also assist you on specific things, to say maybe if you to choose a situation, a scenario, and also to link it to your inputs and outputs. But the other thing, you guys, you can do it on your own. Is it so?
Yes, we understand that, sir. But as for me, it's too difficult, because I've never been in the field of risk management. It's my first year doing the risk management. Quite unfortunately, it's a postgrad on risk management. So I think I'm going to be needing the little bit of the assistant there.
No, it's fine. Where exactly do you want me to assist you?
Okay, so I'll keep you updated, because I need to go through to my assignment first before I can just commit myself on what this thing you're going to be assisting with. But I need to go through to my assignment first, then I'll see what difficulties I'm facing, then I'll get back to you.
Perfect. So, okay. Then that's good. Then the other guys, Jau just said she will come back to me if she has any troubles with the assignment. Then the other guys, what exactly do you want me to assist you with?
I think Jau and I are in the same boat. So yeah, should I get stuck? And yeah, I will get in touch with you should I get stuck while doing the assignment. Yes.
Okay. The reason why I'm asking this is also for me to know where exactly you want me to assist you with, so that at least when I'm preparing for something, at least I'll try to allocate it to different people to say, oh, okay, fine, maybe Javo was saying she's struggling with this one, and Tumelo is struggling with this one. Maybe I'll try it. If it is common, I'll just work on something which is just common, and then we'll address it in our next lecture. But anyway, I understand you guys have been committed somewhere during the week, so I can't expect you. Today is Friday. I can't expect you just to have a person on what you need to be assisted.
I think the notes that you have right now, maybe if you just share just after the class, and in the recorded class, we're going through and writing our assignments, putting it in our own words, doing our own research. I think it might help. Be a point where for me, I can already see that I'm gonna be stuck, but I just don't know at the moment to tell you where. But for us, the notes, I think that will help a lot. And the recording that will contribute a lot to helping me just get started. Then where I get stuck, I can ask the relevant question to say I'm stuck here. I'm busy with this kind of a model, and then maybe you can just clarify something for me. But I will let you know myself as well.
Okay. So I think the best thing, it's fine. I think let's just say, when do you understand? When do you understand, guys, to meet again for question 3 and 4?
The public holiday, no?
Do we have a class on Sunday? What's happening on Sunday?
Yeah, we can.